When you're in your eating disorder, eating disorders can really make you do things that are truly not in line with your values, such as lying to others, hiding things, just becoming irritable and not so nice to other people. And I do have a tool here that I want to talk about that could really help in eating disorder recovery and to aid its motivation for eating disorder recovery as well. First, welcome to my channel, or welcome back to my channel. My name is Stephanie. I'm Long Island's eating disorder specialist. I post on this channel 3 times a week, all about eating disorders, body image issues, and general mental health. So if any of that interests you, please click the subscribe button down below. Also, I have an Instagram and a weekly blog. I would leave those links in the description below as well if you're interested in checking them out. And of course, I would really appreciate it if you gave it a thumbs up at the end of this video if you enjoyed it or found it helpful. Alright, on this channel, often I talk about DBT, which is dialectical behavioral therapy. However, there are also a lot of other tools from other different modalities of therapy that could be truly helpful in the treatment of an eating disorder or just general life. It could be helpful for. One of those is committed action. It is a tool used under the umbrella of acceptance and commitment therapy, or ACT for short, ACT therapy. And this really, the idea is to address your values, to help you to commit to your goals, and to really aid you into achieving those goals. And I'm going to walk you through exactly how that looks like and how we can address it in eating disorder recovery. First, of course, we have to address what is committed action. According to an article by Dr. Laura Chang on mindfulnessmuse.com, I will leave that link in the description below if you want to check it out yourself, there's 4 domains in committed action. The first domain is choosing an area in your life that you have a high priority to change, that it ranks high on the things that you want to change or address in your life. The second domain is choose which values you would like to pursue in this area of your life. Number 3, develop goals that are in line with those values. Number 4 is take action mindfully. What that really means is that things just don't happen overnight. Things just don't just happen without you putting any effort in. So it really is important for you to be very mindful about what you are trying to do, what you are trying to address in your life, and to take action. Let's talk about it in terms of eating disorder recovery, because that is most likely the reason why you are on my channel. So the first domain, as I had said, is choose an area in your life that is a high priority for you to change. And if we're talking about eating disorders, we're going to talk about that the very domain that you want to change is the fact that you have an eating disorder, you want to improve, and you want to move along in recovery. So that would be that domain, that you want to recover from your eating disorder. And the next one is to choose which values you want to pursue in eating disorder recovery. So this may be a multitude of things. I'm just going to stick with one just to make it very simple, but you could add in as many values, of course, and you should when you are really working this through yourself. So the second one, I'm going to choose the lying, because a lot of times in eating disorders we can get very dishonest with the people that we love, and it really isn't because you're not loving those people, or it's nothing about that, but it really has to do with hiding the eating disorder, protecting the eating disorder. And that's what the eating disorder causes you to do. It causes you to protect it through things that may be not in line with your values and that you wouldn't do ordinarily, such as lying. Some examples of lying would be that you didn't eat all day and then you come home and say, oh, I already ate, therefore you're not going to have dinner. That's a lie, right? Or a lie is that I really don't feel well, I'm not going to be able to meet you for lunch today. Maybe that's a lie too. So these things cause you to continue on in your eating disorder. So that would be a value within this domain of your life, the eating disorder recovery, that we can use to aid in recovery, and really is something that's very meaningful to you. The next domain is choosing goals that are in line with this value that will aid in the domain that you're trying to change in your life, which means we need to develop goals on how we're going to work on honesty for our eating disorder recovery in the long haul. So some goals for this particular instance might look like you making it a goal to not lie to others and when it's about protecting your eating disorder. So how does that really look? I would encourage you to go through my video. It's on SMART goals, which really outlines how you should set goals to really be the most effective. So for this particular one, we need to understand that it's easier said than done just to not lie if it's something that you've been doing for a while to protect your eating disorder. How do you go about this then? It's really important to, one, you need to be honest with yourself, because if you're not honest with yourself, you probably have no idea, or you don't really actively think about it when you are just lying to others, because you probably convince yourself of the same things, or that you just don't need to eat, which is why you think it's okay to just say, oh, I already ate, just to not worry them or anything like that. So one, we need to be honest with ourselves about this particular thing. The value then is that you're going to be honest with others. And that starts with yourself, and then to really challenge yourself that just to be honest, like even if that doesn't change what your behaviors are after the fact, the important part of this, for this particular goal, is to just be honest about it. Be like, yes, I didn't eat all day. I'm not going to do what you think I should do still right now, but it is important just to get that honesty out. And of course, ideally in recovery, we would love to see that you are doing what you should be doing in order to recover, which might mean, which would mean eating and doing all the things like that. But right now, we're just focusing on the honesty part. So forcing yourself and trying your best to be honest with yourself, and then in turn being honest with others. Now, you are a human being, so be forgiving to yourself. You probably will slip up. You probably will have times that you aren't as honest as you would like to be, and that doesn't mean that, all is lost. What's super important about this is then to come clean. When you realize, and when you are able to be introspective enough to realize that you weren't super honest, or weren't honest as you should have been, then perhaps going to that person and being like, listen, I don't like this. I don't like that my eating disorder continues to help, or continues to make me lie, but I do want to come clean to you, because I think, and I believe, and I value honesty. I believe that that is super important. So I'm going to tell you that I was not honest earlier, and I just want you to know that. Maybe another way to go about it is for the people that you may have a tendency to lie to about your eating disorder, have a conversation with them and say that this is what I'm struggling with. I'm not always honest with you. Maybe it would be helpful for you if you were to ask me when I say something like, is that the truth? Because I'm going to have a hard time looking you in the eye and saying that it is the truth when it is not. So those are just some ideas for this particular domain, but there's a lot of different domains that might be helpful for you to, or I'm sorry, values that might be helpful for you to continue on in your eating disorder recovery. As I said before, maybe you are hiding your behaviors, which is also aligned with dishonesty. So that might be a value that you want to address it through committed action. Or perhaps you want to address the value that you like to be kind to people and nice to people, and because of your eating disorder, you are very irritable, and that's something that you can work on through committed action as well. The last domain, of course, is to take action mindfully. So that is actually putting that goal into motion and being very mindful about what you are doing. That's, checking back, how that might look is like at the end of the day is to look over and kind of just go through, was I honest today? Was I as honest as I could have been today? And how are you going to correct something if you did something that wasn't in line with all of that? Or how can you improve it for the next time that you're faced with that situation? And that is taking action mindfully. Committed action really is just checking in with our values and creating value-based goals. I also did a whole video about meaningful goals and setting meaningful goals, because that's really the way that we can be effective in our goal setting and achieving those goals, is by making goals that are just meaningful to us and also are in line with our values. A big part of committed action under the acceptance and commitment therapy is creating and following through with values-based goals. Committed action could really help in eating disorder recovery for a multitude of reasons, but especially when it comes to the dishonesty and the hiding and those types of behaviors, it's really, really, really imperative to remember that secrets keep you sick. When you are not fully transparent and fully honest with your eating disorder, with your struggles, it will keep you sick, and that is not conducive for eating disorder recovery. Additionally, it could be really helpful because you might not want to totally be honest with them about behaviors that you've been doing, and that might help you to not engage in the behaviors. For instance, if you typically lie about not having purge and you're trying to not lie anymore, you might not really feel comfortable totally by saying, oh, I purge, so that could also help to inhibit you from engaging in the behavior of purging. So there's a lot of different ways that it could really be helpful in your recovery. Whether you are struggling with an eating disorder and working on recovery, or there's another part of your life that you really want to work on, I am challenging you to engage in committed action over the next week or the next month or whatever it might be over the next couple days. And I really would love it if you left in the comments below what domain in your life you are choosing to challenge yourself with this committed action. I hope you liked this video. As always, if you did, please give it a thumbs up. You could click my face over here to subscribe to my channel. And I wish you commitment on your journey to finding your state of balance. I'll see you in my next video.